Welcome back to the NExT Appraisal Tool modules. This module addresses question 6, is the study design clearly described? When critically appraising evidence, you want to consider the level, quality, which is related to methodological rigor, quantity, and consistency of evidence. Study design is critical because it directly impacts level of evidence. Traditionally, a pyramid has been used to illustrate levels of evidence, also known as the hierarchy of evidence. It is expected that higher on the pyramid, the higher the quality of evidence, and therefore the stronger the evidence. This is because as you move up the pyramid, there is lower potential for error or bias, which would lead to you making a wrong conclusion about the study results. In other words, if you have several studies that examine the same intervention and outcome, the studies using the randomized controlled trial design are expected to have stronger evidence. All designs can have bias. It just depends on how well the studies are conducted or executed. While reviews are at the top of the pyramid, that evidence is only as strong as the studies included. Experimental studies have more control than non-experimental, and a randomized controlled trial is the gold standard design for determining the effectiveness because it maximizes the amount of control an investigator has to reduce error. The shape of the pyramid also illustrates the relative amount of information at each level. At the wide base of the pyramid, we typically have a larger amount of information. As you move up towards the top of the pyramid, there's less information. In this pyramid, research evidence is represented by levels 1 through 4, and then levels 5 through 6 are non-research evidence, the lowest levels of evidence. While our critique tool is intended for use with a single, primary, or original study, we want to take a moment to describe Level 1 evidence. Level 1 includes systematic reviews and clinical practice guidelines based on structured, rigorous, comprehensive reviews of studies. The power of Level 1 is these summaries include numerous studies rather than a single study. In addition, the studies have been carefully selected, critically appraised, and then synthesized to provide clinicians with the summary of the best available evidence about a topic. A systematic review focuses on a rigorous review of quantitative studies. A meta-analysis is also a systematic review, but it includes a statistical analysis of results across studies to calculate a summary statistic that represents the effect of an intervention. This is the size of the effect of the intervention on the outcome, or it's the strength of a relationship between two variables across the studies. A metasynthesis is a compilation of qualitative studies. While we consider Level 1 the strongest, remember, evidence from these summaries is only as strong as the studies included in the review. Level 2 includes experimental research, the randomized controlled trial, or RCT. There are 3 elements of an RCT: a control group, researcher-controlled independent variable or intervention, or random assignment to a study group. This is the strongest design to support internal validity or our ability to detect whether an intervention has an effect on study outcomes. The stronger the internal validity, the more confident we are in results. A randomized controlled trial uses a longitudinal prospective design, meaning it follows individuals into the future, and it allows for the testing of cause and effect. We know with certainty that the cause, or the intervention, occurred before the effect, the outcome. A control or comparison group supports the internal validity of a study. Without a control group, there might be alternative explanations for a change in the outcome in addition to the intervention. Alternative explanations for the study results may be characteristics of individuals or events that occur outside of the study. Common threats to internal validity that are minimized by having a control group include history, testing, and maturation. The threat of history refers to the threat that an event occurred during the course of the study that explained results. Examples of events include implementation of a new practice guideline or a pandemic. The threat of testing refers to the experience of completing tests or surveys that can change a subject's score on subsequent surveys. This might be because their knowledge or their skill changed simply because they were completing it more than once. Maturation is a threat to internal validity because individuals naturally change over time, such as fatigue, hunger, and aging. The longer the period of time between the intervention and outcome measurement, the greater the threat of maturity. For example, a pediatric asthma patient might have greater adherence to the use of a maintenance inhaler simply because they're maturing and becoming more responsible rather than they were exposed to an educational intervention. By having a control group, the researcher can examine if the change in the outcome is related to the intervention or alternative explanations. Whether the researcher has control over the intervention affects internal validity. When a researcher has greater control over the intervention, the fidelity of the intervention should be higher. Intervention fidelity refers to adherence to the intervention protocol. The higher the fidelity, the stronger the internal validity, and the greater the ability to detect a statistically significant change in the dependent variable, and again, the more confident we are that the intervention causes the outcomes. Next, we'll talk about random assignment or random allocation to study group. Random assignment to study group supports similarities between the intervention and control group, and internal validity is supported. When groups are similar, researchers can be relatively certain that any difference in the study outcome was caused by the intervention and not differences between the study groups. Even with randomization, it is possible there might be differences between the study groups. Authors will compare characteristics of the sample at the beginning of the study, at the baseline, to identify any differences. These differences are called potential confounding variables because they're alternative explanations for the study outcomes other than the intervention. The author should describe how they handled or attempted to control these confounding variables. Researchers will often try and control them in the statistical analysis. We'll discuss more about confounding variables in multiple regression in the data analysis module. Randomized controlled trials might also have a qualitative component. In addition to collecting numerical data, it might collect qualitative data or words to help explain the effects of the intervention. When a study includes both quantitative and qualitative approaches, this is called mixed methods. A Level 3 study is also called quasi-experimental. This means it is like experimental but not identical. This design is prospective and examines cause and effect, but it is missing one of the three elements of an RCT. It's missing either a control group, random assignment to study group, or a researcher-controlled intervention. Most commonly, it's missing random assignment to study group. Level 4 includes evidence from non-experimental studies. In contrast to experimental studies that use randomization and other methods to control bias, observational studies occur in the natural setting, having factors that bias results. Descriptive studies answer questions such as what is, how many, how often, to report the characteristics and the extent to which a phenomenon occurs. They may examine a phenomenon at one time or over time. Correlational studies examine the association between and among variables. A positive association tells us that as the amount of one characteristic increases, the amount of another variable increases. A negative relationship tells us that as the amount of one variable increases, the amount of the second variable decreases. Cohort studies follow one or more groups over time to examine whether exposure to a certain factor is associated with subsequent development of a condition or disease. It's usually prospective in that the investigator follows the group into the future and then compares incidence, prevalence, or the frequency of an outcome. Similar to a cohort study, a case control study also examines the association between a risk or exposure and an outcome. Where a cohort study typically follows subjects prospectively, a case control is retrospective. In a case control study, a researcher identifies those with the outcome, the cases, and then selects those without the outcome, the controls, who are similar. Cases and controls are matched based on demographics or other important characteristics that are risk factors for the outcome. This design increases the similarities between the two study groups to help identify those risk factors for the outcome. Level 4 also includes qualitative studies that collect words rather than numeric data to explore or describe a phenomenon, explore experiences or social processes, all from the perspective of the participants. There are numerous types of qualitative approaches, such as phenomenology and ethnography. Because quantitative and qualitative research differ, different appraisal questions are needed. Our appraisal questions are intended for quantitative research. Level 5 is non-research evidence. We have project descriptions and literature reviews. In contrast to Level 1, these literature reviews summarize findings across studies but have less rigor. Often these reviews will not include many details, if any, about the strategy to search for and select articles, or they will not have appraised the articles. As mentioned earlier, a randomized controlled trial is a longitudinal prospective study, meaning it follows study participants into the future. A retrospective study examines data that's been collected in the past for another purpose, such as a study that uses medical record data. Cross-sectional studies collect information about all the variables at one point in time. This design examines associations among the variables, but because it measures predictors and outcomes simultaneously, it cannot determine causality. This design is often used for surveys of large populations to determine prevalence of a problem. Our census is an example of a cross-sectional study. Random sampling from a larger population increases the ability to generalize or apply results to that population. The extent to which results are generalizable is external validity. Random assignment occurs after enrollment to the study and increases internal validity by creating similar study groups. When evaluating an article, look for a description of how subjects were assigned. If randomization was not used, group assignment might have been influenced by characteristics of the participants. This bias can lead to differences between groups. Authors should report any differences between study groups, describe how they addressed these differences, and explain how differences may have affected the study results. Next, we'll talk about concealment and blinding. Concealment and blinding improve study validity or the trustworthiness of results. Concealment refers to whether individuals assigning participants know which study group the participant will be assigned. A common procedure to conceal assignment is the use of sealed envelopes indicating the study group that were made before recruitment. Single blind is when participants are masked to the study group. Double blind is when both the participants and those providing the treatment are masked to study group assignment. Without blinding, participants might behave differently, and providers might treat patients differently across study groups. Both of these would bias study results. A third blinding strategy is for the evaluation team and those conducting the analysis. This is referred to triple blinding. Let's look at an excerpt from a study to answer our appraisal question. As you look for the information about the design, evaluate if the description is clear enough to determine the level of evidence based on the hierarchy of evidence. When developing your answer to the appraisal question, reflect on how well the author described the design. In our example, the design was easily found in the design section below the header Material and Methods. The authors clearly reported using a randomized controlled trial, and this allowed us to easily determine the level of evidence. It's a level 1. When there is an intervention, the reader can appraise the article further by asking, is the intervention clearly described? Was the intervention manipulated by the investigator versus an existing intervention? Let's look at an excerpt from an article by Dunn and colleagues. In this study, the authors were testing an intervention that included a motivational interviewing component. The MSS group received motivational social support from a nurse, and the MSS plus SOS group received additional social support text messages from a significant other. You may wish to pause the presentation to take a moment to read the text. The authors describe the length of each session, who delivered the intervention, where the intervention was delivered, the timing and activities of the subjects, and specifically the completion of 2 tools. When appraising an article, consider the author's description of how study personnel were initially trained and ongoing activities that assess intervention fidelity. In another section of the article by Dunn and colleagues, the authors describe the training of the intervention nurses and monitoring of intervention fidelity by conducting reviews of randomly selected audio recordings of the intervention sessions. This description supports the validity and therefore the credibility of study results. Now let's form a response to our appraisal question when there is an intervention. In this study, the author provided details about motivational interviewing session, the training, who provided the intervention, and ongoing assessment of adherence to the protocol. Information provided supports intervention validity and allowed us to compare the components of this intervention with other studies. Congratulations! You successfully completed this module. You may return to the main menu or continue to the other appraisal modules and the NExT EVP course.